Welcome to NCPDP Unscripted, the podcast where healthcare meets real talk. Each episode, we will dive into unscripted conversations with industry leaders, changemakers, and innovators discussing the challenges, breakthroughs, and behind-the-scenes stories you won't hear anywhere else. Whether you're on your morning commute or taking a break between meetings, settle in because it's time to get unscripted.
Okay, so we are here at NCPDP Annual Conference 2026. Thrilled to have Scott Biggs from IQVIA join us.
Thank you for having me.
Yeah. So you are here. You always do our keynote sessions, and really appreciate all the information and healthcare trends that you share at that keynote. So once again, thank you, and we're going to dive into that a little bit. So.
Well, thank you for having me. I've been around NCPDP a long time, so it's an honor and a privilege to actually get up there and share in front of the audience. So
yeah, fantastic. All right, well, let's start with, I mentioned who you are, but give us a little background. How long have you been at IQVIA, and, even before that, where were you?
Yeah, so I've been with IQVIA for this fall, it'll be 15 years.
Oh, fantastic.
I came over to IQVIA through acquisition, through a couple of smaller consumer research organizations. Prior to that, I spent about 10 years working at Rite Aid's corporate headquarters. So I've been around the industry for about 30 years. So I feel I know more about pharmacy than my original education, which is accounting.
Oh, okay.
So you do not want me doing your books, but you do want me analyzing your pharmacy data.
Right. That's great. I love it. I think there's so many of us that have been around for a long time. My background was marketing. And so, it's a kind of interesting how we end up in this space.
Yeah, so. We try to pick out what we want to do at 18. We're not really ready to figure out what we want to do with life.
Right, exactly. Yeah, and somehow we land places. So, all right. Well, during your keynote, you covered lots of trends. I'd like you to just maybe pick one or two of what you think are kind of the most important shifts that we're seeing out in the market.
Yeah. One or two, that's hard. But there are two things that are really sticking with me right now as I started to dig into the data, and I did say from the stage that some of it is still preliminary, but the impact that the MFP drugs are going to have on the marketplace. I just started to dig into the data and seeing some impacts there. A lot more research to go on to really dig into what's going on there. But definitely with these programs and what's coming up in the future in 27 and 28, definitely going to have some impacts on the industry. And then the next big thing is what the obesity category of drugs is really doing in the marketplace. I think it is directly impacting the way the consumer looks at it, and the manufacturers want to know, how do I get to the consumer? So it's really this birth of these direct-to-consumer, whether you want to say direct-to-consumer or direct-to-patient. Yeah. It's these type of programs that they're really figuring out and figuring out a way to get to the patient.
Yeah, absolutely. And I know, the CMS Bridge program, which is allowing Medicare beneficiaries to access these drugs, has been really interesting. That's something we're working on here with CMS. What's that going to look like when you end up at the pharmacy counter?
I know.
How's that going to work?
It's going to be very interesting to watch that data, and that's the next big thing I have on my horizon to look at. When that starts rolling in, what are we going to see with the data? We tend to look now at when a new drug launches. We always want to see what happens in the first weeks after it. So now you got a very big program with some drugs. So what's going to happen with that in the first weeks? I know we'll be anxiously waiting for that data to roll in.
Yeah, absolutely. Great. So, with all these kind of changes, how's the pharmacy landscape evolving? I know you touched a little bit on, pharmacy closures and rural pharmacies. Would love for you to just talk a little bit about that as well.
Well, I think that the closures that we've seen in the industry, I was always sad to see, so many friends leave. I mentioned I worked at Rite Aid, so when Rite Aid closed, that was one that hit close to my heart because I know so many people live there. I think pharmacies are finding the ways to really make sure they're there for the patient. The pharmacist is such a talented individual. I hear Colleen Lindholtz from Kroger often say, we want to see pharmacists practice at the top of their license. And I hear a lot of people say it. Yeah. And there is so much more that we can tap into with our pharmacists there. And I'd love to see us be in a position where I don't want to get on a soapbox, where pharmacists are given more authority to do more around the country. I think it would be beneficial to really help out. We think of the rural healthcare areas where there are not a lot of primary care physicians available closely for the patients. Yeah. So if they can have a trusted professional that they can get to, that would be awesome for them.
Yeah, absolutely. So let's go back to the direct to consumer discussion a little bit. And I think, patient kind of expectations are changing a little bit too. We're starting to see Trump RX and we're starting to see these direct to consumer patients. So, when you guys are looking at the data, talk a little bit about that and how that's impacting, what you're seeing.
Yeah, very, very big, very impactful in the industry. I feel like every time I'm turning around, I'm seeing another program.
Yeah.
And there have been a lot. We're trying to keep up with all the programs that are out there, and there is a lot going on. But I think everyone's looking for the way to get to the consumer. I think what we need to remember in our industry is that we have these, through the supply chain and everything, throughout the end user is the consumer.
Yeah.
So we want to make sure we get the patient the medicine they need when they need it, and that they can stay on it. So I think these direct-to-consumer programs are one way that manufacturers are looking to make sure they can get that into the hands of the patient. And these obesity programs, we had almost a miracle drug with everything that these things can do.
Yeah.
So people want them. So they found ways to go ahead and get it to the patient.
Yeah, that's great. So, there's lots going on in our industry. We're starting here at NCPDP to really focus on innovation. And, I think there's, so many companies out there doing innovative things. Where do you see the biggest opportunities for innovation kind of across the healthcare ecosystem and then specifically in pharmacy?
Yeah, I think one of the biggest ones I see across the whole system is some of these digital devices, whether it be from anywhere from a Fitbit like I wear to the iWatches to other devices that can help people to understand their own health better and to help manage conditions, to help manage medication adherence.
Yeah.
Those things, I think there's a whole realm of those things out there. But I think that those are the ways that we can really see some changes in the healthcare ecosystem.
Yeah, that's great. And, you kind of layer pharmacy on that. We've talked about, how can a pharmacist help a patient maybe with a digital device, right? Activate it, help them use it. I think of, my elderly patients who may get a device, they'll see their pharmacist more often. They can be the ones kind of helping them. And
Exactly. We need to make sure we're educating the pharmacists on how to do that.
Yep.
And to make sure we're communicating it to the patients, to let them know that the pharmacist's not just there to give you your medication, but to help you understand the medication, help you understand those devices that can help you with it.
Yeah, absolutely. All right. So, as we start to wrap up, just kind of looking ahead, how do organizations kind of stay ahead of these trends and kind of what you're seeing in the data? I mean, we talked about a lot, direct to consumer devices, things like that. Any advice for like the organizations or any, guidance, and again, kind of based on the data of what folks should be thinking about?
Yeah. I think that we talked about it already a little bit. It's a direct to consumer. I've talked to a lot of people out there that are like, how do I get involved in the direct to consumer? I think everybody wants to figure out how they can get, it's the popular thing. So how do we get involved in it? So finding the ways to talk with manufacturers and getting involved in those programs so they can make sure they're getting what they need to give to the patient.
Yeah.
So I think that's the biggest thing is how can we make sure that they're plugged in to help with that?
Yeah, fantastic. Well, Scott, thank you so much for joining me today. I know you have a busy schedule, and like I said, we always look forward to your presentation at our annual conference. So thank you again for that and joining me on the podcast today.
Oh, thank you very much for having me. It's been a pleasure. Thank you.
That's a wrap on this episode of NCPDP Unscripted. Thanks for joining us as we explore the voices and ideas driving innovation in healthcare. If you'd like to be a guest on the show or have topic ideas you'd love to hear us cover, we want to hear from you. Until next time, stay curious, stay connected, and stay unscripted. Our podcast is proudly sponsored by Marks Productions.